postpartum infection second master degree under supervision دكتورة إيمان محمد عبد الحكم Assistant Professor of Obstetrics and Gynecological Nursing Faculty of Nursing بنها University prepared by أسماء نبوي أبو النصر 2020-2021 General objective at the end of the lecture the postgraduate student will be able to upgrade their knowledge about postpartum infection. Specific At the end of this lecture, the postgraduate student will able to define puerperal sepsis, 2. Enumerate risk factor of puerperal sepsis, 3. Know signs and symptoms of puerperal sepsis, 4. Identify complication of puerperal sepsis, 5. Identify treatments of puerperal sepsis, 6. Design nursing management of puerperal sepsis, 7. Define breast mastitis, 8. Enumerate risk factors of breast mastitis, 9. Enumerate signs and symptoms of breast mastitis, 10. Identify treatment of breast mastitis, 11. Design nursing management of breast mastitis, 12. Define breast abscess, 30. Enumerate signs and symptoms of breast mastitis, 14. Identify treatment of breast abscess, 15. Define urinary tract infection, 16. Enumerate type of urinary tract infection, Bulinephritis or cystitis, 17. Nursing intervention of postpartum infection. Outline. Introduction. Puerperal sepsis definition, risk factors, complication, treatment, breast infection, mastitis, breast abscess, breast mastitis, definition, signs and symptoms, treatment, nursing prevention, breast abscess, definition, signs and symptoms, treatment, nursing prevention, urinary tract infection, Bulinephritis, cystitis, Bulinephritis definition, signs and symptoms, treatment, nursing prevention, cystitis definition, signs and symptoms, treatment, nursing prevention. Sepsis. Introduction. Postpartum infection is the major cause of maternal morbidity and mortality. It usually arises from organisms that constitute the normal vaginal flora due to presence of amniotic fluid, blood, and leukia. They increase the risk of infection by decreasing the vaginal acidity and providing an alkaline environment which encourages the growth of bacteria. Infections can also easily enter the female genital tract externally and ascend through the internal genital structure during the vaginal birth. Definition. Infection of the genital tract at any time between delivery of fetus till 42 days after delivery. Risk factors for puerperal sepsis: obesity, diabetes, impaired immunity, immunosuppressant medication, anemia, history of pelvic infection, cervical circlage, prolonged spontaneous rupture of membrane, prolonged labor, manual removal of placenta. Signs and symptoms: fever, rigors, diarrhea or vomiting, breast engorgement, redness, abdominal pelvic pain, wound infection, offensive vaginal discharge, urinary symptoms like frequency, dysuria, and burning, reduced appetite. Therapeutic management, initial IV antibiotic treatment, give oxygen to maintain O2 saturation above 94%, give IV fluid resuscitation, measure hourly urine output من خلال كاستر. Nursing management, identifying the risk factors that predispose women to infection, monitoring the woman's vital signs and physiological change, encouraging intake of balanced diet and adequate fluid to support the immune system, providing self-care activities for the woman until she is well enough to perform them, administering analgesic to enhance comfort and reduce pain, teaching specific procedures such as wound cleaning before discharge, supporting breastfeeding. Nursing prevention of puerperal sepsis, antenatal period. Prophylaxis include improvement of nutritional status to raise hemoglobin level of the pregnant woman, improvement of antenatal visit to discover any problem, limits any type of infection, controlling of hypertension and diabetes, providing the woman to intake plenty of fluid, limitation unnecessary vaginal examination, prepare good hygiene. Intranatal period. The nurse maintain strict medical asepsis and teaching the woman technique to minimize the risk of infection. Hand washing is the most effective strategy. Changing perennial pads with each voiding and at least every 2 to 3 hours. Encouraging use warm baths with perineal laceration or episiotomy. Encouraging women to drink fluid liberally and empty her bladder frequently every 2 to 3 hours. Establish the antiseptic and sterilization procedures such as cleaning hands immediately prior to delivery, cleaning perineum, cleaning delivery surface. Sterilize the surgical instrument, restricting vaginal examination to minimum in premature and prolonged rupture of membrane, strict adherence to sterile procedure, avoiding unnecessary castration, avoid unnecessary episiotomy. Postnatal period. Aseptic precautions for at least 1 week following delivery until the open wounds in the uterus, perineum, vagina are healed. Sterilized sanitary pads are used. Established good intravenous access. Institute intravenous antibiotic like ampicillin. Less visitor. Maintain good personal hygiene. Look out for early signs of infection. Infected baby and mother should be in isolated room. Breast infection or breast mastitis. Introduction. Mastitis is infection of the mammary gland. Is seen primarily in lactating women. It is estimated that 2% to 33% of lactating women develop mastitis, which is more common in primipara. Typically, The lactating process is well established before mastitis develops. The highest incidence is seen in the second and third week postpartum. It can occur antepartum, but this is rare. The infection is usually unilateral and is preceded by marked engorgement. Definition: breast mastitis, an infection of the parenchyma of mammary gland, usually occurring within the first 2 to 3 weeks of the postpartum period. Infectious complication involving the breast, from benign inflammation to breast abscess. Risk factors: previous history of mastitis while breastfeeding, sore or cracked nipples, wearing a tight-fitting bra, improper breastfeeding technique, becoming overly tired or stressed, poor nutrition, and smoking. And symptoms: fever, chills, 38.3 Celsius or greater, breast tenderness or warmth to touch, severe pain, breast swelling, pain or burning sensation continuously or while breastfeeding, skin redness, generally feeling ill, complication, mastitis that isn't adequately treated can cause a collection of pus, abscess, to develop a breast. An abscess usually requires surgical drainage. Therapeutic management: antibiotic, antimicrobial therapy, breastfeeding should be continued, analgesic. Nursing management: women must be encouraged to practice personal hygiene measures, encourage women to increase fluid intake. Breastfeeding is encouraged at frequent interval every 2 to 3 hours to promote milk flow through the breast. Heat packs or hot showers are used to promote circulation to the area, especially before breastfeeding. Mild analgesia is used to relieve pain. The breast should be pumped or emptied on the affected side to relieve engorgement. Ice packs can be applied to reduce pain. Trying to ensure that your baby feeding correctly. Massaging the breast while breastfeeding or pumping from the affected area down toward the nipple. Nursing prevention: the woman should be instructed to avoid putting pressure on the breasts. Instruct the mother to pay attention to prepare positioning and how baby is lactating on. Massage to the hardened area to try to open blockage milk duct. Provides invaluable advice for proper breastfeeding techniques. Instruct the mother breastfeeding to avoid missing or shortening feeding time. Breast abscess. Definition: breast abscess is defined as a localized collection of inflammatory exudates plus in the breast tissue. It is a complication of mastitis. Risk factors for breast abscess: complication of lactation mastitis, maternal age above 30 years, first pregnancy. Signs and symptoms: tender lump in the breast, pus drainage from the nipple, persistent fever. Nursing management of breast abscess. The woman should be continue to breastfeed. Wipe the nipples and the areola with sterilized cotton dipped in a boiled cold water or some breast milk. At the end of a feed, allow breasts to dry naturally on the air. Apply ice packs daily to the nipples and areola to relieve pain. Good hygiene and daily wash with soap. Dry well. Keep the nipple and areola clean. Nursing prevention. Make sure that baby is lactating properly when breastfeeding. Avoidance of stoops of the nipple. Gentleness when washing breasts. Breast cleanliness. Wash with water. Wear clean bra. Frequent changing of breast bra and good hygiene. Intermittent exposure the nipple to the air. Proper hand washing before handling the breast and before breastfeeding. Make sure that bra and clothing is not too tight. Keep breasts clean by washing them daily with mild soap and water. Urinary tract infection. Definition: urinary tract infection or UTI is an infection in any part of urinary system which includes kidney, bladder, uterus, and urethra. Risk factors: diabetes, anemia, poor personal hygiene, problems emptying the bladder completely, urinary cluster, bowel incontinence, kidney stone, pregnancy, menopause. Types of UTIs: cystitis, Bulinephritis. Cystitis is an inflammation of the bladder. Bulinephritis is an inflammation of the kidneys or an inflammation of bacterial origin of one or both of kidneys. Symptoms: shaking, chills and fever, nausea or vomiting, pain in upper back or side angle, tenderness, bacteria, increased serum white blood cell count. Diagnosis: urine test, therapeutic management, antibiotics for 3 to 7 days or as doctor recommends. Nursing management of Bulinephritis: close observation of vital signs at least 4 hours or more often, monitoring intake and output. The nurse support immune function and tissue healing by encouraging rest and therapeutic diet. The urine is observed for evidence of the blood. Complete physical assessment is conducted at least every 8 hours. Increasing fluid intake. Administration of antibiotic and analgesic. Cystitis. Definition of cystitis is an inflammation of the urinary bladder. Signs and symptoms: urinary urgency, urinary frequency, dysuria, suprapubic pain, material not always present. Therapeutic management: antibiotics. Nursing management for cystitis: the woman should be hospitalized, observing for symptoms of ascending infection, measuring fluid intake and output, encourages increased fluid intake at least 1000 milli hours. Teach women about proper use of oral antibiotic. Analgesia or agents that reduce bladder spasm may also to be given to reduce bladder discomfort and urinary urgency. Take all of your medication on schedule anyway. The nurse supports immune function and tissue healing by encouraging rest and therapeutic diet. Don't stop antibiotics early and completing follow-up. Nursing prevention of urinary tract infection. Routine measures for urogenital cleanliness, adequate fluid intake, frequent voiding, early treatment of vaginitis, promote cure and healing, such as maintaining therapeutic diet, wipe from front to back after a bowel movement. This prevents bacteria in the anal region from spreading to vagina and urethra. Empty your bladder as soon as possible. Nursing care plan. Nursing assessment. Assessment and symptoms of postpartum infection. Nurses should review factors that may increase the risk for developing infection. Breast assessment. Assess and examine the woman's breast frequently after birth for signs of infection or inflammation. Urinary tract assessment. Assess and examine the urethral opening for injury, laceration, redness, swelling. Ask the woman about difficulty of emptying the bladder. Nursing diagnosis for puerperal sepsis. Risk of infection related to presence of significant risk factor. Nursing intervention. Nurses should use the following guidelines to reduce infection as a general management. Offer advice on the signs and symptoms of life-threatening conditions include sepsis. Review the client's history for pre-existing infection or chronic conditions. Monitor the vital signs and laboratory result for any abnormal value. Maintain aspect technique when performing an invasive procedure such as urinary catheterization. Reinforce measures for maintaining good perineal hygiene. Monitor the frequency of vaginal examination and the length of labor. Assess frequently for early signs of infection, especially fever and lochia. Inspect the wounds frequently for signs of inflammation and drainage. Acute pain related to body response to infective agent, probabilities of infection. Nursing intervention. Assess location and nature of pain. Provide instruction regarding maintenance of cleanliness and warmth. Instruct client to relaxation technique, such as radio, television, or reading. Encourage the woman to ask for pain medication before the pain becomes severe. Change client's position frequently. Provide comfort measure like back props, linen changes. Least body requirement intake of nutrients insufficient to meet metabolic needs related to intake insufficient to meet metabolic demands. Nursing intervention. Discuss eating habits including food preferences and intolerance. Note total daily intake and output. Maintain diary of calories intake and time of eating. Promote intake of at least 2000 ml per day of juices, soups, and other nutrition fluid. Encourage intake of foods high in protein, iron, and vitamin C when oral intake permitted. Encourage adequate sleep and rest. Administer parenteral fluids nutrition as indicated. Administer iron preparation and vitamins as indicated. Nursing diagnosis for mastitis. Risk for ineffective breastfeeding related to inflammation as evidenced by pain in breast. Nursing intervention. The nurse instructs the woman how to apply warm compresses breast every 2 hours. The nurse will observe the mother breastfeeding her infant to assess the possible lactating problems. The mother will take ibuprofen for pain and to decrease inflammation. The nurse educates the mother about the early signs and symptoms of mastitis before the end of the office visit. Administering the antibiotics as ordered. Support women on lactation. Encourage women to empty her breast manually using breast pump. Acute pain related to inflammation of breast tissue as evidenced by tenderness and warmth of touch. Assess vitals for signs of systematic infection. Assess for baseline and note location of symptoms. Mastitis generally occurs on only one breast at a time. Note skin quality and presence of cracked nipples that may indicate potential for infection. Drinking water helps to promote milk production and flow. Apply warm compresses before breastfeeding or milk expression to allow for the expression of breast milk. Apply cool compresses after breastfeeding or milk expression to relieve pain and soothe sore breasts. Administer medication ibuprofen to reduce pain, inflammation, and fever. Examine patient breastfeeding. Observe position and baby's leg. Provide lactation education. Pump or manually express milk after each feed. Alternate breasts when feeding. Adjust or alternate positions for feeding. Nursing diagnosis with urinary tract infection or UTI. Acute pain related to inflammation and infection of the urethra, bladder, and other urinary tract structures, evidenced by burning on urination. Nursing intervention. Assess client's description of pain such as quality, nature, and severity of pain. Suggest use of non-pharmacological techniques as appropriate. Encourage increase oral fluid intake 2 to 3 liters if no contraindication. Encourage the use of citrus bath. Instruct to avoid coffee, tea, alcohol, and sodas. Apply a heating pad to the suprapubic area or lower back. Encourage the use of analgesic or antispasmodics. Dysfunction in urinary elimination related to frequent urination evidenced by dysuria. Nursing intervention. Assess the patient's pattern of elimination. Palpate the client bladder every 4 hours. Encourage increased fluid intake 3 to 4 liters a day if tolerated. Encourages the client to void every 2-3 hours. Instructs the female client to wipe the area from front to back and avoidance of bus tubes. Thank you.